Hi everyone, this is Dr. Latika Chawla. I'm a gynecologist and a laparoscopic surgeon, and today I'm going to take you through the peritoneal pull-through vaginoplasty that is done for gender reaffirming surgeries. So we're going to cover this in three parts. One is preoperative planning, intraoperative vigilance, and postoperative care. So when I do see my patient for the first time preoperatively, what are the things I'm looking for? I'm generally looking for the pointers that are going to tell me how successful the outcome of the surgery will be. If the patient is anemic, which means that if the hemoglobin is low or they have less blood, or if they are smokers, I know that the post-op recovery is going to be affected. So pre-operatively, I would want to ask them to reduce smoking or stop smoking for the 6 weeks period, and also to develop their hemoglobin, give them either iron injections or blood to make sure that the hemoglobin gets built up. The other thing I look for is any scars on the body. If there are any surgeries that have happened prior to this one, I am going to expect a lot of adhesions, as we call, inside the body, which means that the internal organs are stuck to one another, which might make dissection slightly difficult. If the patient is too thin, I know that the fatty layer that is present below the peritoneum is going to be lesser, and so dissecting the peritoneum is going to be quite a challenge. The last step of preoperative understanding is that one needs to have a comprehensive consent, which is going to talk about the laparoscopic complications, internal organ damage, risk of hemorrhage, risk of infection in these patients. And it's very important for us to make sure that the consent is well explained and signed before we start the procedure. Coming to what I do intraoperatively, it's very, very important in these cases to be vigilant because you are dissecting around a lot of important internal organs. Generally, there are 4 cuts that are made on the abdomen, typically being between 0.5 to 1 centimeters. The largest one, that is a 1 centimeter cut, is usually above the belly button. But that assessment is also made once we see the distance between the belly button to down below, something called as the pubic symphysis, which is a bony landmark. So once I've made that assessment, I plan my incision accordingly. There are going to be 2 incisions on the left side of the abdomen and 1 on the right. After taking 4 cuts on the peritoneum, where I have now demarcated where I want to dissect, I will start dissecting and create a peritoneal flap, which is a random pattern flap created from 2 lateral sides and the posterior wall of the bladder based on the rectosigmoid. The dissection that is closer to the pelvic floor is the most challenging because that is where we are going to create the peritoneal part of the neovagina. Once I have my surgeons dissecting from down below, there is going to be a plane that is identified in the pelvic floor where we make an incision and we transfer the peritoneum, and the peritoneum is pulled through to the newly created vagina. Then the apex of the vagina that is newly created is closed with a purse string suture. Most of the times, the neovagina heals beautifully because peritoneum has its set of secretion, it's self-lubricated, and because the vascularity of the peritoneum is maintained, it does not undergo necrosis and adhesions. The raw areas inside the peritoneum heal beautifully. Within 6 to 12 months, the peritoneum that is lining the neovagina also becomes like vagina. Coming to post-operative care. Post-operative care is probably the most important part of a peritoneal pull-through vaginoplasty. We are, of course, afraid of any infections or, of course, hemorrhage because it's a very long surgery that the patient does have significant blood loss, and if the hemoglobin is low, then recovery is affected. So perioperative blood transfusion is something that can be considered in these cases, and of course, broad spectrum antibiotics, which makes sure that you don't land up with an infection. Regular dilatation of the vagina is needed in these cases to ensure that the vaginal length is maintained and the vagina does not collapse. We understand that the gender reaffirmation surgery is an extremely long and challenging ordeal for our patients. The patient needs to be brave and the surgeon even braver. Working as a team helps us focus on the patient so that our patient goes home with a new identity and we go home with a new sense of fulfillment.